Hello, everyone, and welcome to Arthritis at Home. My name is Ellen, and I'm the program coordinator. Today, I'm joined by Nejat Hassen, who is a master's student under the supervision of Dr. Diane Lacaille at Arthritis Research Canada. Her research explores a variety of factors that influence what we call our quality of life. Even though it's specific to rheumatoid arthritis, we hope and I'm very confident that in future, this research may be generalizable. Welcome to our show.
Thank you so much for having me.
So Nejat, you and I are colleagues and we get to work in the same space. So this is really an exciting opportunity for me to learn a little bit about you because I'm unfamiliar with this.
Yeah, it's a really interesting field within rheumatology, I think. Just being in the same space, we see each other's projects and we know how hard each other are working. And it's kind of nice to explain it a little bit in friendlier terms and in easier concepts that everybody can hopefully understand.
Absolutely. So may I ask or start by asking for the audience, how are you involved in rheumatology and maybe how did you get to doing this kind of research?
Absolutely. Yeah. So as a kid, I loved sports. I was involved in many different sports for many, many years. And that led me to studying kinesiology, which is the study of human movement and exercise. And I really loved that. And I was so fascinated by how the joints and the muscles and the bones all work together to execute our daily functioning. And as I was studying more, I became more and more interested in the medical side of things and conditions that would affect our bones and our joints. So that led me to pursuing my master's in population and public health at UBC, specifically focused on rheumatology related research.
Very interesting. And can I ask, I know that your research focuses on quality of life, but can you explain to all of us what is quality of life and what is it, or in specific health related quality of life, and why is it important?
That's a really good question. I think when we think about quality of life, it's this very broad concept that encompasses so many different layers and facets of an individual's life. But generally speaking, it's really looking at the self-assessment of one's own well-being. So we're looking at things that affect your quality of life, maybe from your physical health standpoint, from your mental health, your social relationships, how you interact with the environment. So all these different things can influence someone's quality of life. And if I were to ask you how you would rate your quality of life, it would be very different than how I would rate my quality of life. And that really stems from maybe we have different values, maybe we have different interactions in our day-to-day, maybe we have different belief systems. So all these different things culminate into something we call quality of life. And when we look at health-related quality of life, it's looking at this concept from a health standpoint. So when we think about health, the World Health Organization defines it as not only the complete absence of disease, but being in a state of good physical, mental, and social functioning. So when we look at what is it that actually affects quality of life or health-related quality of life, we're looking at the factors that relate to our physical health, that look at our mental health, that look at our social health. So you can see that it can get very multidimensional and can get very subjective. But we're looking at steering away from looking at health as simply a medical or through a medical lens and looking at it from more of a holistic perspective.
Yeah, I can see how this is, truly, it's beautifully complex, but measurement becomes difficult. So if you don't mind, sharing with us, how do you measure something so abstract, subjective, varies day to day, varies person to person?
Mm-hmm. So for in literature, we see health-related quality of life becoming this more and more. It's becoming an important health indicator, not only for patients, of course, but also for health practitioners. So when we measure quality of life or health-related quality of life, we can do that through surveys. We can do it through different means of asking people to report back on how they would assess their own quality of life, to capture that subjectivity a little bit. But it's important to measure this because, at least from a scientific point of view, once we identify what are the factors that influence our health-related quality of life, then we can work towards focusing our energy and our resources on maybe tweaking or mitigating some of those factors to ensure that we actually do have a good health-related quality of life. In the future, perhaps it can inform more disease management strategies. So if we know what to look for, it would make it a lot easier to treat and to manage in the future.
Well said. And as you know, my area of interest is the management side of things.
Great.
And for my own interest and for the viewers, could you share with us what are some of the factors that you have captured as a part of your research that may predict, influence, have a correlation with a health-related quality of life?
So it was really interesting. We know that from previous research, just reading into the literature, health-related quality of life in individuals living with rheumatoid arthritis is generally lower compared to the general population.
Okay.
And so where my research comes in is wanting to identify what are those factors that actually influence one's health-related quality of life in a rheumatoid arthritis sample. So we looked at people that live in British Columbia that live with rheumatoid arthritis. And through surveys, we asked about a whole host of factors, about 22 factors, in fact. And
Wow.
we wanted to look at which of these factors actually influence their health-related quality of life. And then we wanted to compare them and see which one of these actually contribute the most to quality. So the way we did that was we measured baseline assessments. So in 1 year, we measured all of their factors. And then in the next year, we looked at what their health-related quality of life was. And we categorized all of these 22 factors into 4 groups. So we looked at their demographics. So things like age, gender, education levels. And we looked at lifestyle factors. So this is things like smoking status or physical activity. And then we looked at rheumatoid arthritis specific factors. So things like pain and morning stiffness and fatigue. And then our 4th group was something called comorbidities. And these are conditions that an individual may have in addition to rheumatoid arthritis. And we look specifically at things like obesity and depression. So at the end of all of our analyzing and looking at all the different factors, we found that, in fact, the previous year's health-related quality of life actually influenced the next year's quality of life the most. And this kind of made sense to us. We didn't really expect health-related quality of life to fluctuate so dramatically from year to year. But from the 4 groups that we looked at, we saw that comorbidities was actually the one that contributed the most. And from the factors within the comorbidities group, we saw that depression was the most contributing factor to health-related quality of life.
Wow, I'm surprised and also not surprised. I would think that pain, just because, from my very superficial knowledge of the literature, pain seems to be an indicator, but I can see how depression then actually influences pain, and then pain, like it's not as linear as we think, right? We think like A leads to B, B
That's right.
gives you C. It's this network of very much so subjective
Mhm.
influences. Yeah, so interesting. So
Absolutely.
Now that you know that, for example, depression is one of those key factors that influence our quality of life, especially for someone living with rheumatoid arthritis. Can you see, in future, or do you have any recommendations or calls to action for other researchers to use this information, and because this is really important information, to add it to an intervention?
Absolutely, yeah. So, um, these are really important findings, and perhaps I also thought coming into it that the disease-related factors would be the most contributing. And in fact, we did see this. We did see that disease activity and physical functioning were the next two important factors. And this just emphasizes to us that, yes, good disease control is very important for good health related quality of life. But specifically from the depression side of things, I think this finding is quite important. Number one, as a patient, it kind of validates your experiences. As a patient, you know that rheumatoid arthritis is not specifically a joint related disease, but it does affect many different facets of your life. And not everybody perhaps could understand that. So having something like this would increase awareness. But from a clinician side of things and from a disease management side of things, knowing that depression is an important factor can help us inform more our disease management strategies moving forward. It emphasizes that, yes, physical health is important to consider, but our mental health must be addressed as well. And perhaps incorporating depression screening tools in our routine arthritis care and follow-up appointments might be one way to address this. But at the end of the day, really increasing our awareness that, yes, our mental health must be considered and should be a part of routine care is quite important, and hopefully would inform the strategies that clinicians use going down the line.
Thank you for that, really well thought out response, because you're right. Our intervention, so to say, is so there's so many different levels to it. And even as, an individual who knows somebody with rheumatoid arthritis, or with arthritis, that you can now take this information and be like, okay, perhaps them seeming down or not as energetic, or not as
Mm,
physically functional, that's the condition. And being able to see through that lens is just, or even a friend, because we all know somebody with arthritis. If
yeah.
if you're watching this and you are yourself not a patient, this is still key information from a healthcare provider's perspective as well. If you can improve symptoms of depression, or you're able to design an intervention that also accommodates and addresses the
Mhm.
mental health aspect, then you're also able to then improve the physical function, the disease activity, right?
Absolutely.
Because it's not so linear. And really, really beautifully said. And I'm excited to see what are the next steps. But Najat, I know you still have some time in your master's degree, but you've come so far in such a short time span. Can I ask, what have you learned so far? What are your greatest takeaways from your research, from your time as a trainee?
It's been such a privilege to be in this position as a trainee at Arthritis Research Canada, amongst superb um, and scientists and trainees like yourself. And um, one thing that I really took home from this experience is that from rheumatoid arthritis is multifactorial, and um, attaining a good health-related quality of life is also multifactorial, and it can encompass both your clinical factors and your non-clinical factors. And it's important to raise awareness about that, because I don't believe everybody perhaps understands that just yet, that health should be viewed from a holistic lens. And one thing that I also really learned was that as you're treating rheumatoid arthritis and any really arthritis or any condition, it's important to treat the person as a whole and not to treat exclusively, symptom by symptom. The symptoms might be walking into the clinic, but it is the person that needs the treatment and the management as a whole. So really emphasizing that and remembering that in future, clinical practice and future scientific research, I think is really important and would help improve patients' quality of life in the future as well, and help scientists and researchers have a better understanding of what exactly is actually quality of life and how it is affected.
Thank you so much for that response. And it resonates deeply with me, and I know it does with the audience. So, Nejat, we want to thank you for your time, and we do wish you the absolute best on your research adventure. And if you do have anything new to share with us, we look forward to having you in future.
Thank you so much. Thank you for this opportunity.
And with that, I'm going to welcome everyone back to our next episode, Arthritis at Home, next week. And with that, take care and have a great rest of your day. Bye, everyone.